Well, hello and welcome to the Small Business Briefing, the 2022 edition. It is incredible to me that we are already at 2020, although in a lot of ways it's more of the same, unfortunately. This is episode number 226, and as you know from last week's episode, that I have a new co-host, and it is Sarah Miller. Sarah, hello.
Hi, Brian. Happy New Year. It is your first show as president and CEO, so we thought we would mention that for all of you watching. As we talked last week, and you know, Rob Fowler has now retired. Maybe he's tuned in. I don't know, Rob, if you're watching, you'll have to comment and let us know. But before we get into Data Monday, I do want to recognize our very generous sponsor, Marana Group. And Marana Group is a data, document, and distribution solutions company. And you can learn more about them at maranagroup.com. So again, thank you to Marana Group for your sponsorship. So we talked last week about the numbers. We looked at the data. I know I saw some things over the past week that they're continuing to climb. So I'll let you get into it, Brian, and kind of share where we are right now.
Very, very active time around the country right now, and here in Michigan. Last week, I had mentioned that what we had seen in terms of the increase in other places, the kind of telltale signs of the Omicron spike, that it hadn't started in Michigan, but really it looks like in the last week it has now. Let's just take a look at a heat map for the whole country. As you'll notice here that Michigan is, the color's a lot lighter, except for where the main population center is in Southeast Michigan. So you see, even though the shade of Michigan counties across the landscape looks like there's a lot less concentration, our numbers still are way back up, and it has a lot to do with just the regions of our state that you see with the darker shade there are those with higher population and driving the overall numbers. But I wanted to also point out down here at Florida, a couple weeks ago, it was the only dark county was on the heat map was Miami-Dade, and then it's really spread across the whole peninsula. I do expect that's going to happen over the next couple of weeks here in Michigan as Omicron takes over from Delta. But the highest in the country right now is New York, so it's a new high. We've seen in the past it's been Puerto Rico. If you look at it on a per capita basis, Puerto Rico and Rhode Island. We're going to talk about both of those states here in a few minutes, but New York being the highest and the Northeast being the highest. But if you look across all the regions have pretty much straight up lines, and I think all of them are going to move more in unison than what we've seen here in the past. Also wanted to compare the infection rates to hospitalizations and deaths as compared to the last 6 months of 21 and 20 and then to 2020. And so basically, this 6-month period that we just finished, you see cases finished at 120%, but hospitalization at 57% of last winter. And this is nationwide, by the way. This is not Michigan. This is nationwide. And deaths at 36%. So we are seeing a decoupling, if you will, between cases, hospitalizations, and deaths. Again, it's a little bit different story in Michigan, where we actually had kind of an extra wave in there that most of the rest of the nation didn't see in the spring of 2020. And so our numbers actually are much less favorable looking as compared to this, but encouraging to see this type of decoupling between cases and hospitalization in this winter, or at least the last in the last couple months compared to the previous wave in 2020, the winter wave of 2020. Looking at the deaths per capita, again, across the nation, high vaccination counties versus low vaccination counties, undeniable difference here. The low vaccination counties are still riding with really high, if the waves go up, deaths and hospitalizations go up more. Not the case with high vaccination counties, where you see the variance. The deaths and hospitalizations still go up in those areas, but not as much as you can see from this chart. Looking around the country over on the right-hand side here, this is the country as a whole. So you can see that Omicron wave is really a vertical line. But looking at a lot of these other countries or states over here, you see New York, which is the highest per capita, 300% of last winter's peak. So a lot higher than what they saw before. Puerto Rico is one that we're going to look at in a minute, because Puerto Rico really hadn't experienced anything like this before, but it's an interesting case study because they have unusually high vaccination rates, and we're going to see a really impressive decoupling of hospitalization and deaths in that territory. And then in Rhode Island, we're going to feature a little bit later on because of some tough choices they've had to make with respect to hospitalization rules. Around the country, though, unfortunately, you do see an increase in hospitalizations that are happening. They had come down from the what had been driven by the South in the past, and now back up, mostly driven by the Northeast and the Midwest. And then, but you're not seeing deaths increase at the same level. So I do expect they might still go up some because the law of large numbers is about to kick in. Omicron has a lot more infections, and even though it's clearly now presenting as less serious, when it hits that many more people, it's going to get to vulnerable populations, and therefore you're still going to see these numbers rise. But again, encouraging to see it not moving like we've seen it move in the past in the most serious cases. Now, here's what Michigan looks like. Michigan, I think the fact that we had this kind of slow rolling Delta wave that had happened over the course of several months, going back to late summer, that had started to come down. I think that was kind of masking a growing Omicron wave. And now, of course, in the last week or so, you see it pretty much shooting straight up. So it's definitely here in Michigan. Mainly right now, this increase is being driven by Southeast Michigan. That will change, I'm fairly confident of, in terms of it spreading across the rest of the state. In terms of hospitalization, unfortunately, we had seen it come down a little below 4,000. By the way, 4,000 is still kind of crisis mode for hospitalizations in Michigan. It had dropped down that, but now has inched back up. And our numbers, this, by the way, this chart is as of the end of last week, and today's numbers show more of the same in terms of the trends inching in the wrong direction. The hospitalizations, if you take a closer look at Michigan's hospitalizations, just zooming in on the last 90 days, you'll see that it was coming down, but now this is the average, and you see each day, the actual case count for each day is now higher than that average. So you're going to see that average continue to increase over the next few days at least, but depending on how high the numbers get, you'll see these hospitalizations increase as well. Have not yet seen deaths start to increase. They were coming back down, and but still, 100 a day is near the top of what it's been, and because this is a lagging indicator, we don't know for sure yet what's going to happen with this one. Let's take a look at this is Puerto Rico. Now, Puerto Rico has very, very high vaccination rates, so you might it might be tempting to say, in fact, I'd say unusually high vaccination rates. It might be tempting to say, well, look, what good does it do? Because you look at this spike, it's way, way higher than it's ever been. It is clear that Omicron is able to evade the vaccinations in terms of causing an infection. But if you look at overall in hospitalizations, in fact, let's just take a closer look here at the last 90 days. You'll see that while hospitalizations are clearly going up, you can't have an increase of 300% above the previous winter without seeing your hospitalizations go up. But I just want to do a little math with you here. So hospitalizations around 400 in Puerto Rico. There are 3 million people. So if we were to do the math, that would be like saying maybe 1,400 or so hospitalizations in Michigan right now. Well, we wouldn't be in crisis mode if that's all we had. And hospitalizations in Puerto Rico, while they have risen with this Omicron wave, the fact that they have unusually high vaccination rates is clearly making it a difference when it comes to the seriousness of this wave. their hospitalization per capita is way, way lower than Michigan's, which we have 10 million people and 4,000 people, a little more than 4,000 people hospitalized. They have 3 million people and about 400 hospitalized. So, and looking at their deaths, this is completely decoupled from what they had experienced in the past. And also, though, I'd point out their per capita deaths per day is not just lower than it's been throughout the entire pandemic there, in terms of the other waves of the pandemic, but it's also way lower than, I mean, on a per capita basis, way, way lower than Michigan's at some of our lowest points. So all that to say that that we are in for, and we're going to experience I think a pretty complicated next 4 to 6 weeks because of a dramatic increase in exposures and breakthrough infections. But what is clear, two things. First of all, the rate at which this variant causes hospitalization is less, but the higher vaccinated populations end up having a lot less hospitalization and death as a result of it. And so I continue to believe that even though it's going to be a really tough winter in front of us and a very complicated one for small businesses to manage through, that there are signs that are popping up all over the place that the pandemic is moving into an endemic phase, something that would look more like an annual, the annual bugs that run through our world all the time. So knock on wood with that. I'm not an epidemiologist myself, although I feel like I listen to and follow more epidemiologists than any other type of person out there anymore. And it really is, I think there is growing confidence, especially as you look at those countries that are a little further along than us in terms of their experience with Omicron, that it's very contagious. It's a very fast moving wave. It goes up quickly, also goes down quickly, and then it on a per capita basis will have fewer hospitalizations. But again, in a population as big as ours, if we end up with, if it's 50% more, if it's 50% less likely to result in hospitalization, but you have twice as many cases, you still have the same number of hospitalizations because you have twice as many cases. So that's the type of math that's in front of us now. I mean, I think our biggest problem is just the law of large numbers. This is going to get to more people. It's going to get to more vulnerable people. There are going to be breakthrough infections, and so it's going to make the disruptions in our economy continue to be problematic and challenging.
Right. So with this increased, threat of infection, what is the CDC recommending now in terms of quarantine, isolation? I know that they did revise their guidance last week. So kind of walk us through what that looks like for those of us who are vaccinated or maybe not yet vaccinated.
They have they've put out a change, and it's a change to reflect what they've known about the coronavirus in terms of its how long you're contagious. They've known this for a while, that it's very unusual for it to be contagious out 10 days. And that was kind of, managing to the outliers as opposed to managing to the majority of cases. And so they were kind of inspired, I think, by the problems in the airline industry to back off the quarantine days to 5 days instead of 10, because with this many exposures, there's going to be a lot more people in quarantine, and it could really set the economy back substantially without necessarily making a big difference in the overall management of the virus. If you really are only contagious for, more like 5 instead of 10 days, having people sit home, it doesn't give you any public health benefit, but there's a big economic cost. So for anybody, vaccinated, boosted, unvaccinated, doesn't matter. If you test positive for COVID, the recommendations are the same, and that is stay home for 5 days. And now that would be 5 days from the onset of symptoms is when they consider that kind of starting point. You might not necessarily get tested right away or get test results back. but 5 days from the onset of symptoms. If you have no symptoms or they're resolving after 5 days, they recommend, even if you're COVID positive, that you can now rejoin your activities, that you're no longer contagious, but to continue to wear a mask for the next 5 days. So that's for everybody, no matter what your vaccination status is. Now, if you're exposed to somebody, but you have not tested positive, they have different reactions or different recommendations depending. So if you're boosted, or you've recently completed your series of fully vaccinated, so you maybe decided to get the Moderna vaccine, last say October or November, and you just completed, you're not eligible for a booster yet, you've got some new antibodies. So in that case, so you're boosted, you've completed your vaccine series in the last 6 months, or completed the Johnson & Johnson vaccine in the last 2 months, they just recommend you wear a mask around others for 10 days. So no quarantine recommended, wear a mask, and then test on day 5. They say, if possible, test on day 5. Tests are hard to come by in some parts of the country right now and in some parts of our state. Now, if you have completed your vaccine more than 6 months ago and have not been boosted, or more than 2 months ago with the Johnson & Johnson vaccine, or you're unvaccinated, they just asked after an exposure that you stay home for 5 days. That's the recommendation. And then another 5 days to be masked, assuming that you did not develop any symptoms. So basically the two categories are, you're boosted, in that case, no quarantine. If you're not boosted and not recently vaccinated, that you quarantine for up to 5 days, and after an exposure. Now, the big difference on this compared to what you might remember from before is that it's exposure, not close contact. Before they said close contact, and it was 15 minutes over a 24-hour period within 6 feet of somebody who has COVID. Like, it was pretty laid out there. It didn't necessarily mean more passing contact. In this case, it says exposure and it's not defined. What do they mean by exposure? I mean, it's something left up to your judgment in terms of, was there meaningful contact in terms of their recommendation.
Right. That'll be interesting to see how this all plays out, especially as we're talking to our members. So what does this mean for small businesses? What do business owners have to do? What should they do? And kind of like, how can we help them, get this all straight in their heads?
Well, one thing to keep in mind is that these are recommendations. So these are not quarantine edicts or requirements. They're not orders that have been issued. MIOSHA most recently had been relying on CDC guidance, but there's no MIOSHA order in place, save for the vaccination order that is pending in court right now. And so this is still up to the judgment of the business and how you want to manage it. But I would recommend that you think ahead about how you want to handle both exposures and positive cases that are brought into your workplace, because you're much more likely to face that in the next 6 months than you have been, or 6 weeks, than you have been over the course of the last couple of years. So this is a question you'll be faced with. Rather than kind of dealing with it on the fly, it makes sense to maybe brush off that COVID-19 response and preparedness plan. We've actually just updated ours, the template. Maybe get that out and think about putting something in place so at least you're consistently managing through it. And when it comes to MIOSHA, if an employee were to file a complaint on you, even though there's no orders out there right now, having a consistent response, I think, would be a good way to kind of remove any risk at all that there could be an investigation or a ticket issued or something about workplace safety conditions. If you had a policy and you stuck with that policy.
It is always good to be prepared. I'm always kind of thinking, let's prepare for the worst here, and then hopefully the best happens. So it's good. Now, over the weekend, I think I saw that Dr. Fauci was talking about potential revisions to the guidelines that they just changed. Can you shed some light on those, that potential?
There was a lot of political pressure over the weekend with respect to the idea that you could have a COVID positive, and then if your symptoms are resolved, you go back with, back to work or back to, groupings with people, or back to contact with people after 5 days without a negative test. And the reason for that is because if symptoms are resolving, you don't need a negative test to know that your symptoms resolved. And so if you're still contagious, those symptoms would be much less likely to have ended. But there was a lot of criticism, a lot of pressure that was put on the administration about not having a testing recommendation in terms of somebody coming back. And so there were some hints or some expectations, really, I'd say expectations that were laid, that this guidance would be further revised in the next week or so to say that if you're COVID positive, not to leave isolation until after you receive a negative test. I think the administration or the CDC was trying to be practical before, and understanding that in many parts of our country, tests are just not available. And if we know that the science says that resolved symptoms means that you're no longer contagious, then why utilize the resources or add that kind of a demand on a system that's already strained? But it looks to me like the CDC is going to change course on that recommendation, and we'll probably see that late this week.
Okay, so we'll keep everyone updated as we hear more. I know I've looked for some at-home tests just to have on hand, especially with a son going back to school this week, but they are very difficult to come by. So that testing requirement might prove difficult for some people to manage. So as we look here back in Michigan, I know you talked about MIOSHA, but do you think that the state of Michigan is going to do anything differently than the CDC? I know they said they were going to just follow the CDC guidance, and we shared some information to our members this morning, but is there any further indication that something else might occur?
Well, our state at first said we're not going to adopt the guidance, but I think it gets really complicated then for your citizens and saying, wait, is it 10 days? Is it 5 days? The CDC saying this, the state saying that. And so the state ended up kind of reversing that earlier decision. They said, we're going to wait a while, get some more information. And then right after that said, you know what, second thought, we're just going to adopt the CDC guidance. That was a good indication, but not in the form of an order. Again, so even though the feds aren't ordering it, the state is not ordering it at this point. I think that we're much more likely to see the state changing guidance and rules for entities like schools and congregate living facilities, but regular private sector workplaces, I continue to believe that it's much less likely that we'll see the types of changes or requirements. If we are to see additional requirements, it'll be because from the federal level, that if OSHA ends up winning at the Supreme Court, then that's where you'll see requirements come. I'll be pretty surprised if we see the state certainly take moves to, I would certainly be surprised to see the state take moves to close down businesses again.
Good. All right. So let's go back to Omicron a little bit here. You talked about the peak, it's here, it's coming. But what more can you tell us about this particular variant?
There are lots of pieces of information that are coming from other countries. A lot of the studies and the tests, some in the lab, some out in the field, in the United Kingdom, in South Africa, and so we're getting a better picture of what it really means. So first is that the CDC tries to predict waves, and they think like mid-January might be the peak of Omicron's wave. Now it looks like it's starting later in Michigan, so I would take that CDC estimation and push it out a week or two or three and say, Michigan's will probably be later than the rest of the nation, because we have seemed to have trailed it somewhat. So the first thing is to say that that it looks like it would, even though it's going up a lot and really fast right now, that that perhaps not too long, goes up fast and comes down fast. But also there's an indication that Omicron is developing less severe infections. And so it has to do with where the infection settles. So with Omicron, it's settling more in the nose and throat as opposed to in the lungs. And the lungs are where you have the most serious problems with COVID-19 and previous variants. So the fact that the main part of the infection is settling in a different place is the reason why you see less serious overall outcomes. Again, vulnerable populations, way more people getting infected. It's finding its way to those vulnerable populations. So it doesn't mean that that this is going to be easy. In fact, it's not. This is going to be very complicated and difficult portion of our winter here. But overall, people infected with Omicron are about half as likely to be hospitalized as compared to those with the Delta variant. And that's coming out of the UK, which really the gold standard for public health statistics and controls. And then laboratory study in South Africa suggests that people who have recovered from Omicron infection are more likely to be able to repel infections from Delta. And the reason I bring this up is because when like a previous Delta infection does not appear to provide much protection at all, just like our vaccines, against an infection from Omicron. But an Omicron infection does appear to provide benefit in stopping Delta. And so in Michigan, where we have two different variants that are still pretty prevalent here, the idea that people are getting Omicron might actually cause Delta to go away. And so that would be, at least, I don't know if you call it a silver lining or what, but then also the several studies now, and I think it's starting to become generally accepted, are showing that that there's much less damage to the lungs, and that's why you see the people saying so much more that this variant is not as serious as some of the others that we faced in the past.
Okay. So as we kind of prepare for Michigan's wave of Omicron or our spike to go up, what lessons can we take from other states? What are other states doing to combat this?
It's no secret that when I try to predict what's going to happen in Michigan, I look around to the rest of the country, what's happening at other places. And I also try to imagine, like, where would our governor be looking in terms of, finding examples. And the Northeast was, in the beginning of the pandemic, seemed like a lot of it was looking to the Northeast, states like New York, but then also to some extent Ohio. But there's a really interesting case in Colorado. Colorado has had, I would say, on average, in terms of hospitalizations and death overall, they've been lower than the national averages in a per capita basis. But their governor there, who's a Democrat, Governor Polis there, has been bragging that they had some among the shortest stay-home orders in the country, that in-person schooling options have been available practically throughout the entire thing, and it's he's seeing really high approval ratings from the voters. And so what caught my attention was that he had a 57% job approval rating with an approach that was much less restrictive, and President Biden had a 47%, 10 points lower. And so I have to believe, look, people that are in public office, they look at, which politicians are doing well, which ones are managing things well, which have high approval ratings, what are they doing differently? And that Governor Polis approach in Colorado, I'm sure that as Democrats perceive that they're facing an uphill battle in this next election with the national winds kind of blowing against them, have to look at an example like Colorado and say, maybe there's something to that approach.
All right, one last topic for today, and it's still about Omicron and COVID, but I think disruption is the word that is on everyone's mind right now. And what are we going to do? What are your insights into how small businesses might be disrupted, into other supply chain issues across the state?
This is really where I think Omicron is going to be the most damaging to the economy, is that there are so many more people that will be exposed because it's contagious. And so absenteeism at a time when we have very high overall high open positions and difficulty in filling positions is that much more difficult. And when you have, even though the quarantine is shorter, that's good, five days, still it would be potentially a series of 5-day quarantines for people that are exposed multiple times. And so this is, I think, is going to be very, very challenging to manage. We see, other places that are they just have to be realistic. Places like Rhode Island, for example, that had highest case numbers in the country a few weeks ago, and they've already in their healthcare system started to back off on vaccine mandates because they just have to have people running hospitals, and also having some COVID positive people continue to work, but working with people that are COVID positive. And so these are tough choices that the healthcare system has to make this has already been so disruptive. I think that the next month or so might be some of the most difficult management challenges that small businesses have had to face with respect to absenteeism since the spring of 2020.
Well, we are out of time for today. We did not get to talk about redistricting, so we will put that on the agenda for Thursday's show. Before we go, I do want to mention two things. One is that we put together our 2021 advocacy kind of year in review. So we're going to drop that in the comments in the chat for you all to review. And then, as Brian mentioned earlier, we did update our response and preparedness template. So if that's something that you want to take a look at for your business, we'll also drop that in the comments, so you can find it on our website. So thank you all for joining us, and we will see you back here on Thursday.
See you on Thursday, everybody.